excuse. And it's kind of hard to digest that, because I bet that she had a lot of excuses just to quit, right? She was in a really difficult time where maybe, she really have to go through a lot of obstacles in order to be heard. But she never took any of the excuses. And I think that it is okay to have excuses. What is not okay is if we dwell on the excuses, right? So each one of us have our own journey, and sometimes we do have some excuses to stop, but hey, as long as we don't dwell on the excuses, we can just go on. We're all successful and we have our excuses, but we just didn't dwell on them, and that's the reason that you guys are here today. So congrats to you, because I know that you guys are accomplishing a lot of things. So let's start with something, the American dream. So I'm pretty sure that all of us have the American dream, even people who have born here, right? But what is the American dream? I mean, last week we went through a lot of tumultuous, week, and I'm glad that that's over. But we all have the American dream. We all have different perspectives of the American dream. We all came to this country with an American dream, something that you kind of wanted to do something here when you came. Some of us came just a few years ago. Some other people came centuries ago, like your ancestors, but they all came with that American dream, something to do better by themselves. And at the end, we all have followed that dream, right? So I'm just gonna share a little bit about what was my American dream when I came here. So in order to do that, I need to talk to you about myself, right? Let's dig into my biography. So I was born in England. But I grew up in Colombia, and my parents, they were always kind of traveling here and there. By chance, honestly, I just was born in England and I got the British passport, which was actually very helpful. But I came in 1999 to Colorado because I wanted to study here. And like many of you, or like your ancestors, I had big dreams and I wanted to get out of the country and just go and study and go to college. And for me, my dream was to study psychology. And I wanted to either go to England because I have everything there, or come to the US because I had some friends here. So I came straight from Bogota, Colombia to Colorado in 1999. And reality kind of hit me, because I noticed that my English wasn't really great at that time. And I wasn't able to communicate with people in Colorado. Because I don't know about you, if you're from Colorado, you probably know this. I mean, 20 years ago, there were very few Latinos. There were about 17%. And the majority of them, they didn't even speak Spanish. So I was kind of like on my own. And so that kind of reality kind of hit pretty strong. I have the American dream to come here, go straight to college, but I just realized that maybe I was going flying a little too high, and I needed to accomplish things first. So I just realized that if I wanted to pursue something, I needed to start from the basics, and I needed to put a lot of effort, and I needed to put a lot of time. So started just thinking, what should I do? And then I realized that I need to start taking some classes, and this is when I hit my first obstacles as an immigrant Latina. And let me rephrase this and tell you again, I'm not saying just as a Latina, I'm saying first obstacles as an immigrant Latina, which, as you guys, some of you know, you deal with immigration, you deal with, if English is not your first language, then you have to deal with that communication and obviously money, right? Because if you're not from here, then you obviously need to have money to pay for you as an international student. So that was my first obstacles, right? And we all have obstacles, and for me as an immigrant was all of this. So I already told you I came from Colombia, but I have my British passport. So for me, it was kind of easy to come to the US. And I know that a lot of times we talk about how successful we are, but we sometimes don't talk about the little things that it was kind of difficult. And I'm pretty straight honest. Immigration was hard, right? Because yes, I came here. British passport. I didn't even need any visa or anything like that, but it was a limited amount of time that I was supposed to be here. So going into college, I needed to have a different type of visa, not a straight British passport was gonna get me into it. So I just realized that I needed to work either to switch visas to student or wait until my dad came to the United States because he was gonna be working as a professor here and change the status. So I'm not gonna bore you with all the immigration laws back then, but it was hard and it took me about 2 years to change the status. In the meantime, I was kind of waiting and waiting to get into college. So those were the first obstacles. Yeah, in the meantime, you get a little distracted and a little defeated because you just want to go on. But yep, it took 2 years. So I wanted to just go straight to college. I didn't know where to go, and I just met the right person. And today, you guys are gonna hear, I'm probably gonna bore you with some people that probably you don't even know, and that's totally okay. But I feel the need to talk about people who have been mentors and who have helped me as a Latina, or as a student, or as a person, right? So you guys are gonna talk to, you're gonna hear me today talk about who my mentors were, who actually helped me. And I want to start with one person actually. This was a Chicano man named Ismail. He's still working at this community college. And he had a small organization and he started like you guys. He wanted to start helping people from color or Latinos, and they wanted to just help them out and to register into classes, help them out with all the registration that they needed, and just to help them out. And I was able to connect with him, and he actually helped me to maybe register with classes and things like that. Really, probably it really doesn't matter for some of you, but for me, that was one of the people who really helped me to put my foot into college. And I really, that's the reason I'm still speaking to him. He's my friend. He still has a small organization. He has helped a lot of hundreds of people of color getting into college. So kudos for him. So he was the one who helped me. So started getting my ESL classes. And for some of you, if you don't know what an ESL class, let me tell you what it is. So is English as a second language is pretty much taking English classes for people who are not native in English. So you pretty much start taking all the goody old grammar and all the pronunciation and things like that. And it takes a little while if you want to take all of them. So for me, I started getting one class at a time. So going from the bottom, and that was while I was waiting for my visa. So it took me about, I would say maybe close to 2 years to complete all my ESL classes, because honestly, you have a lot of classes that you have to take. And at that time, I was just ready to start college and just the regular classes. And I said, well, I'm just gonna jump and I'm just gonna go and start taking my psychology classes. So I just jump ahead and then I registered my first basic psychology class. And believe it or not, I hated it. I started hearing a lot of the philosophers, and they were getting so much into thinkers that I wasn't even crazy about, and I just really hated it. And I felt that it was difficult for me at that time. It was my first college experience in a regular classroom with native speakers, and I just felt kind of like intimidated. So I felt that I wasn't ready, so I dropped the class. And I honestly just kind of felt defeated. And I said, oh my God, what am I gonna do? I'm not gonna be able to start college, and I wanted to do this so much. So honestly, I took a semester off, just thinking about my goals. And I said, you know what, I need to do it. I need to just start, maybe not psychology, but maybe something else. And I decided to maybe start from, taking just any other class. So I decided to do that. And in the meantime, I decided to maybe start taking science classes. So that was kind of different. And I really liked and really enjoyed taking biology classes. So I met a lot of people there, and I noticed that there were people who were kind of into wanting to go and study medicine, go to medical school, and that kind of got me thinking. I said, well, maybe I should actually do that too. And I decided that I wanted to do that, and I started maybe taking some biology classes in order to maybe go into medical school. Why not, right? I was kind of like so fired up. And I decided to maybe start going into those, I'm not sure if you guys are familiar, but those sessions about going to pre-med. And I decided to do that, and there you go, more obstacles. Why? And then I'm gonna go into it. Thank you for not believing in me. How many of you have thought about that in your head? A lot of them, right? There was one experience that actually made me think, thank you for not believing in me, but thank you for not believing in me, because that situation, which I'm going to explain, kind of changed my path. And that was actually pretty good. So I decided to go into biology instead of psychology. And then I started taking more biology classes. And then I decided to go into these pre-med sessions. And at those sessions, there were pretty much professors just telling you a path to going into medical school, what to do, what not to do. And I decided at that time to change my undeclared major to biology right now, because that was kind of like a clear path for me to go into medical school. So I took several of those pre-med sessions. I mean, I kind of knew everybody. I knew what they were going to say. I knew everything. And I was flying really, really high. And I said, I'm just going to meet with this professor who is the one in charge of the pre-med sessions. And I met with him. It took me about like a month to meet with him. And I was thinking while waiting in his office, like, I'm just going to sell myself, and I'm going to say how good I am, and I'm going to say how much I have accomplished as a Latina, and I'm going to tell him about my GPA, and I'm going to tell him that I'm really good, and perhaps he's going to tell me about a little more tips that maybe he hasn't said to other people. So that was kind of like my idea behind. So I met with him, went to his office, and the first thing that he started asking me is, tell me about your GPA. So I was really prepared for that. And I said, I was, thinking, well, it is 3.75, but it's not a 4. But I was thinking in my head, well, I took years of classes. They were not great. And I'm pretty sure that that's not going to count. And I took that one psychology class, which I hated. I did pretty bad. And at the end, I kind of dropped out, but actually affected my GPA. So I wasn't ready to take that college class, so that shouldn't be counted. So I replied, said, I have a 3.75 very firmly and pretty proud of myself. And then he said, well, you kind of need a 4.0 if you want to go into medical school. And I said, oh, okay. And then he also started telling me a huge list of things that I needed to accomplish before thinking about going into medical school. So he also said, I need 5,000 volunteer hours. You also need a reference from all your professors. But in order to have a good reference from your professor, you need to be the top student in your class. You also need to pass your MCAT. You also need to take several of the prep classes. You might not pass the MCAT at the first time. You probably will have to retake. And then also getting into medical school probably is going to be very difficult. And you probably will have to apply to several throughout the country, and probably you're going to have to move. And then he went on, and then he said, are you sure you want to take this path? And that's the reason I put it. Thank you for not believing in me, because honestly, I felt that he didn't believe in me. So what do you mean that if I'm sure? Of course I am, but now with all the list that you gave me, maybe that's not the right path. So I honestly didn't know what to say. I wasn't thinking, well, this obviously I'm not going to be able to do over 5,000 volunteer hours because I'm the one paying for my own tuition. I just need to work. There's no way I'm going to be able to do that. And then the reference from all my classes, well, obviously I wasn't the top, top of the class student, and I'm not going to retake the classes because that takes money and time. So I honestly just felt defeated, and I said, well, fine, I don't think this is for me. So I felt that my dreams were crushed. And because I have this huge dream and I was so focusing on that dream that I just forgot about everything else. But sometimes we need broken dreams, right? And it's okay to have broken dreams. There's a quote that I found is actually very interesting. It says, broken dreams are not the end of the road. They're the beginning of new dreams and a new direction in life. You just need to be strong enough to take the first step. So I'm not gonna lie to you, I was broken and I got very discouraged. I left the office in tears. It took me several weeks to recover, honestly, because I was broken inside. I felt very confused. I felt that maybe it wasn't good enough. I felt that maybe I needed to take a different path, or what am I gonna do? So then I just decided, I've been taking biology classes. Let's keep on taking biology classes. Maybe it's meant to be for me to be a biologist. Nothing wrong with that, right? But different path. Nothing that I was thinking about, but maybe that's what I need to do. So started taking more biology classes, microbiology, and then I started meeting some other interesting classmates. There were some students that wanted to go into the healthcare, right? So a lot of them wanted to go into pharm school. Some other ones, they wanted to go into PA school and nursing. So then it kind of opened my eyes, like, okay, well, I guess medical school is not the only one. There's other paths that I can actually choose. So then I started talking to people. Farm school? No way. I'm not interested in farm, right? But then I even went to one of the PA sessions, the kind of like the medical pre-med sessions. So I went to one of the PA, and honestly, it was kind of like the same. It wasn't, I mean, they still have the same requirements and pretty structure, and it was led by the same professor. So I was like, forget it. I'm just not gonna go there. So I started talking to some of my classmates, and they were so much into nursing. So let me tell you why I chose nursing. So let me clarify this. No, I didn't choose nursing because I didn't get into medical school. That's not right. That people probably will think that way. That's not it. The thing that is that I never chose or never thought about nursing is because I was never surrounded by nurses. And back home in Colombia, nursing at that time, and I'm talking about 20 plus years ago, nurses had kind of like a limited role, and they even had only technical schools. They didn't have bachelors, master's degree. Now it's something else. Now you can get your bachelor's, you can get your master's. So nursing have grown so much in at least in Latin America. So, but back then I just didn't know much about nursing. So that's the reason that I didn't think about nursing. Well, at the same time, when I was kind of talking with my classmates, I started working at a public health clinic as a nutrition educator. Fancy. I was educating low-income Spanish-speaking Latinas who were pregnant or they were recently having babies, and they kind of needed a little help with their nutrition and their diet. So honestly, I got this gig because I was the only Latina bilingual at that time. So I wasn't even ready to educate people about nutrition. But, I got the training and everything. So what it was good about this gig that I had is that at the clinic, there were public nurses, there were nurse practitioners, and they were pretty much in charge of the clinic. And I was amazed. And I pay attention to the roles because like, whoa, you guys are kind of like the man running here. So some of them were in charge of the immunization for the community. Some of them were in charge of the infection prevention, environmental health, and so forth. So that kind of fired me up. I said, whoa, just thinking about getting a nursing degree kind of opened my horizons, because you can do a lot more, right? And I noticed that they were pretty independent and they were taking different roles, and you can actually do a lot of things with nursing. So that's the reason I chose nursing. This is it. This is what I want to be. So kept taking all my prereqs. Now that I knew that I wanted to go into nursing, and I met pretty good professors. So I completed my prereqs while doing that. I met pretty good professors, and there's another mentor that I want to talk about. I remember this professor when I was taking physiology. He was a Peruvian professor, doctor back home in Peru, very smart guy. He was teaching physiology, one of the hardest classes that I ever took. And I don't know if you guys are familiar with that. But he gave me the fire of becoming what I wanted to be. He was always, yes, he was, he was helping us with physiology, and we were reading the material. But at the end, he was always like, okay, so what do you want to be? Okay, you go. He was firing up. He was such a good professor. So that kind of, I wanted to meet with him just to see, okay, well, maybe I need kind of like a little perspective and a little mentor here. So I met with him a few times, and he kind of fired me up, and he is the one who said, believe in yourself, you can do it. So what really caught my attention is, at that time, honestly, I was very shy, and I'm still shy, but I was back there, I was very, very shy. And I was very shy because I felt a little intimidated because of my English, and I was intimidated because of my accent. And talking to people kind of made me nervous, because then what are they going to think about me? And then because he had a pretty strong accent, that kind of like, oh, I guess you can do a lot, and it really doesn't matter if you have an accent. So that's the reason I kind of wanted to meet with him. And he really, that was a good choice. He fired me up, and he said, you can do whatever you want. What do you want to do? And I said, well, I'm kind of thinking about applying into nursing. And he said, hey, you should apply to CU, College of Nursing. I heard that I have a good program. So I did. And then I put this quote because I want to talk to you probably at the end about this. An exemplary teacher will not just enlighten the student, but will also empower the student. And I'm telling you this, you guys are always going to be mentors of somebody. And this is actually key. Always enlighten your student. Always, always. You don't know who needs that pick me up. So he was one of them, and then I did. So I went straight up, and then I went and applied to CU College of Nursing. And guess what? I got the big fat rejected letter. You didn't expect that, huh? So I did get rejected the first time. So another obstacle, right? But at this time, I was sure what I wanted, and I said, you know what? Yeah, obviously I was sad. Obviously I cried. Of course, I was waiting for so long, and then you got the rejection letter. But I decided to believe in myself. I said, I projected myself to be a nurse, and I'm gonna do it. And honestly, I put all my eggs in one spot here, right? Because CU was the only school that I applied, and I said, I got rejected. I'm gonna apply it again because I want to go into CU. I don't care about the other ones. I want CU. So decided to continue just taking on my biology classes, and then reapply for the following year, because you have to, you guys know, wait a whole year. And then finally I got accepted. I got the wonderful letter, got accepted into the BSN program on January 2009. I was supposed to start, which it was perfect timing, because I was supposed to start the BSN program in January 2009. And guess what? I graduated with my bachelor's in biology in December of 2008. So it was perfect timing. I only had like 1 month just to have a break. And then after that, going into the BSN. So I graduated with a bachelor's in biology and a minor in nutrition because I kind of got into nutrition and from the Metropolitan State College. So that's me being all proud of myself. So January came. I'm a CU nurse student. So in 2009, January started there. First day of classes. I'm not sure if I was the only geek there, but let me tell you, I was waiting for so long to be that nurse, a student nurse, that the first day that I went there, I was so excited. Everybody was nervous. I was nervous, right? I was shy too, but I was so excited. Everything was excitement for me. I mean, just going into the library, just doing the tour, going into those, you know, in the subway, you are in one of those little office boxes there, and I used to love going there because it was brand new. And I don't know if you remember that, but everything, we were kind of like the first people or students promotions that kind of went to the campus, and it was kind of brand new, so everything kind of smelled new. So I was really excited. And again, I mean, remember that I came from the Metropolitan State, which is a campus, and you know, you go to the library. I'm not sure. I mean, I'm talking about 20 years ago. Hey, right? Or maybe less, like 15 years ago. There were a lot of homeless people and whatnot. So you know, it didn't smell that as new. So obviously, I was really excited about it. So, but what it was good about going into there is that I met wonderful classmates and pretty good professors, as you guys already know. But I wasn't the only person of color, which was nice. I was the only Latina in that cohort of students, but definitely I was not the only one, and that was really powerful. And I met other, you know, people who were kind of scared, and they knew that nursing was kind of hard because, hey, you know, you guys know nursing is hard. And it wasn't easy. It was very hard, but I was very excited to just fulfill my call to be a nurse. And I have this, I think probably that this is really funny for some of you, me wondering if I should follow my preceptor or if he needs space. I'm not sure how many of you have noticed, or maybe you guys are doing this already, but how many of you have felt that, you know, having really mean preceptors that don't even know where to go? Well, that was me, and I had a really hard time sometimes when I was going into nursing school. I had very mean preceptors, and I have to tell you this because at the end, I'm just gonna hammer you with, you guys need to be nice, right? You guys need to precept, you guys need to be nice. So I did have pretty bad, mean preceptors. Sometimes I felt broken, sometimes I felt defeated. Good thing about going into nursing and having all my classmates is that they were always kind of backing me up, including the professors. So that was actually really nice to have that support. But to tell the truth, I have days where I have stomach aches going into clinicals, and I just didn't want to go because I have this one mean preceptor. And I honestly felt that I probably was gonna treat it a little different. And I just didn't know. And then I got a little kind of timid about talking to this person, timid about maybe my accent. What is it? Am I not smart enough? So, but that didn't stop me. And I also had great preceptors, the people who encouraged me into the profession, and now they're my fellow nurses that I still remember. So not everything is bad, but I still wanted to say that I'm gonna go back to this because I know that we all have been in this place where you kind of have that one mean preceptor. In my case, I have several of them, unfortunately. But so practicum, I was almost ready just to be finished with School of Nursing, and I noticed that I needed to start advocating for myself as a student. So advocating for my needs, what do I really need and want as a student? So I realized at that time that I didn't care to be a floor nurse. Woo, yes, I said it. I just didn't want to be a hospital nurse. I really hated going into hospitals, honestly. I mean, it's weird, right? But I'm not even sure if I have PTSD from my preceptors, maybe. I don't even know. I knew from the beginning I didn't want to go into the hospital, but um, that obviously you need to learn a lot of things in a hospital setting. But I wanted to just be maybe like a public health nurse, maybe working at a patient clinic. So again, I just didn't care about being a floor nurse. But unfortunately, the College of Nursing at that time didn't have any placements, but only hospitals. And I was asking for my senior practicum to request a placement as an outpatient in an outpatient clinic. And of course, I had a little pushback, right? Because they just didn't have. They say you're kind of like the first one who don't want to be a floor nurse, so we don't have a placement for you. But let me see what we can do. So they told me they haven't had any student requests, and it wasn't part of the program, but they were gonna go look into it, and they were able to find a placement. They actually had a great solution. They were able to request a placement at the Sheridan Health Clinic. I'm not sure if you guys are familiar with that, but that's a nurse managed community clinic from CU College of Nursing. And they say, hey, you know, this is the only thing that we can that you can do during your practicum. And say, no, I'm okay with that. I just want to be in that outpatient clinic. So I went there. They paired me up with a registered nurse. And honestly, this is off the record, I didn't have much to do when I was doing my practicum, because honestly, there's not much to do, you know, as a new grad, and there's obviously you don't have the whole experience as a floor nurse. So I had very limited role when I was doing my practicum. But I met this wonderful another mentor, Dr. Vikki Eriksson. She was a pediatric nurse practitioner at the Sheridan Clinic, and she also was the director of the Masters and the DNP program at CU College of Nursing. She was the director from, I think, 2006 to 2014. So she requested, hey, you know, maybe you can pair up with me, you can help me. She was seeing a lot of the Latino community. And honestly, they kind of needed an interpreter. So I was the only one. So I got to see her role as a nurse practitioner, and while I was kind of doing the translation, I was kind of like seeing what she was doing, and she showed me how to be a powerful nurse practitioner in the community. That's exactly what I wanted. I needed a mentor who can show me how to be a leader in our community, and she was very compassionate with the Latino community. And she actually encouraged me to go into the nurse practitioner program. She was the one. She said, you know what, after you're done with your RN, you should go straight and get your nurse practitioner, because I think you should be good at it. And she fired me up. This is another one. And she even said, hey, you know, I'll give you my recommendation letter. Do you want a recommendation letter from me? And I said, of course. I mean, she is the director. And then, so I was thinking, So I got the recommendation letter from the director of the program that I want to apply. So that was kind of interesting. But hey, you know, she was great, and I have to mention her and honor her because she is the one who made me think about being a nurse practitioner. Unfortunately, Dr. Vikki Eriksson died in 2018 due to cancer. So yeah, but we all have to honor our mentors. So finally graduated. I made it and graduated and passed my boards. Kelly Prado, RN. So why do I have the RN? Because I remember that I used to go and study for my boards after I graduated 8 hours a day. I'm not sure why it took me so long, but I was there. You know, my mom used to work at a pizzeria, at a pizza place at campus, and she was working from 7:30 to 5 p.m. and I was there with her from 7:30 to 5, just studying for boards, NCLEX. And sometimes when I was doing all the questions and not passing all the questions. And I kind of got a little scared and like, oh my God, I'm not going to pass boards. What am I going to do? So I decided to kind of visualize myself. And that's a trick that you guys should do. Started visualizing like, you know what do I want to do? I want to be an RN. And I want to see that RN, those two letters next to my name. And I started writing down, Caliprado RN, Caliprado RN. Every time that I felt that I was going to pass boards. And I don't know if it worked or not, but hey, this is a little trick that sometimes I tell my patients. Visualization is key. Sometimes it kind of helps decrease your nervous system, and that it did the trick for me. So graduated, and then I was ready to go into workforce. So who's gonna hire me? Remember, I didn't want to go into hospital. I wanted to be in outpatient public health. Went to Tri-County, nope, there's no jobs available. Went to Jefferson Public Health, nope, no jobs available. So CU sent me an email about a nurse practitioner in mental health who wanted to have an RN, a new grad. Whoa, that's me. I mean, I wasn't thinking going into mental health, but I decided that, hey, you know, this is an outpatient, I should do that. So applied there, got the job. My boss at that time, she was a nurse practitioner, psychiatric nurse practitioner. She was the child team director. She was actually the big boss because she was in charge of all the nurses. She was in charge of all the nurse practitioners, even the psychiatrists. So I was kind of like in awe for everything that she did. She was another mentor. And she gave me the opportunity to be a nurse in her team. And again, translating again, hey, because there's a lot of interpreters, so I was interpreting a lot back in the day. So I was an interpreter, and I was also a registered nurse. So I got to see her role as a psychiatric nurse practitioner because I was interpreting for, you know, her appointments. And I felt this passion about being a psychiatric nurse practitioner. Like, oh, I knew I wanted to be a nurse practitioner. I was thinking into going to women's health, maybe so I can be in public health. But I felt that that was my call. Never thought about it until I started kind of noticing my role, and I felt compassionate, and I felt that that was it. And then a few years now analyzing, honestly, that I think it was last year that came to my like, I remember that I wanted to be a psychologist. And then I kind of wanted to be in the medical field. Well, nursing, nurse practitioner, and then psychology. There you go, two together, right? So I guess I kind of went around and then I started what I wanted to be, the psychologist, but with a medical background. So that's kind of funny. But so decided to apply to psychiatric nurse practitioner, and where? Well, they want to only see you again because I love their program. So applied, I got accepted, and I love the program so much. And it wasn't that difficult, to tell the truth, because I was learning so much as a nurse, and just having that experience that kind of helped me actually to apply what I was learning in the nurse practitioner. So I have a pretty good experience in the program. Graduated in 2012, and there it is. That's my picture when I graduated. So passports and everything, right? Psychiatric mental health nurse practitioner, board certified. Well, kind of started noticing a big gap as a new grad. Being a new grad in psychiatric nurse practitioner, and then seeing the salary, how the salary was really low. And I'm talking about seeing my mentors, people who were psychiatric nurse practitioners for 10 plus years, having very little salaries compared to new grads psychiatrists. Now, obviously they have a different education, but the gap was very, very big. And I said, well, that doesn't feel kind of right. So I started doing a lot of research. And I noticed that, yeah, kind of like the salaries here in Colorado were kind of unfair. So started kind of digging and doing a bunch of research about like, how can I self myself as a new grad nurse practitioner? So started kind of listening to podcasts, websites about HR, what to ask and what you should not answer to HR. And I got really good at it. Like I knew what they wanted me to answer, and I knew what I needed to answer. And I got pretty good to the point that I started getting like really good offers. To the point that my classmates and even my professor were like, "Oh, so what are you doing? Oh my God, that's a pretty good offer." So got pretty good at it. Started even getting emails, calls from people like, "Hey, so how are you advocating for yourself? Why should I say this? Hey, you know, they offered me this, but HR is asking me this. What should I do?" So I got really good at it. They even invited me to do a small lecture about how to sell yourself as a new grad. And I'm still sometimes people here and there sometimes call me about offers. So got pretty good at it. Decided to go back into the same clinic that I was because then I noticed that money is not the only thing. You really need to have a pretty good environment, safe environment, especially in mental health. And it really doesn't matter how much money you get. You have to be safe, and you need to advocate for your mental health as well as a new grad as well. So decided to go back to the same clinic, and I did pretty well. Got bored after a few years, and I said, I think it's time for me to start my own private practice. So I did. Well, it wasn't that easy. I actually started doing a bunch of reading a bunch of books and podcasts again and websites and talking to other people, because unfortunately we do not learn about business. We don't know anything about business. We should. I think it would be nice. So I kind of learned a lot about how to start your own business, and I decided to start my own private practice in October 2016. I founded RxN Live Holistic Mental Health. It is a private practice with a different approach, holistic psychiatry. Now, at that time, 2016, I knew very little about holistic psychiatry, because honestly, 5 years ago, there was not a lot. I was following this one person in Boulder who still teaches a lot about integrative psychiatry. He's one of the big gurus in the nation, and lucky me, he's in Boulder. He has a few books, and I kind of got into it, but I wanted to bring my roots as a Latina, treating certain illnesses with herbs, because honestly, we do use a lot of supplements and herbs. And so I did a lot of research, very limited books, very limited conferences, only that one conference that I went, and but decided, hey, you know, I know a little bit basics, let me start my private practice. So now it has been 4 years that I have my private practice. I have 4 people in staff, and I have 3 offices. Right now, I'm training nurse practitioners in integrative psychiatry, and also really recently finished a fellowship in integrative psychiatry from the Integrative Psychiatry Institute, which is located in Boulder with this person that I told you. And this is partnered up with the University of Colorado School of Medicine. And as of last week, I got officially certified as an integrated psychiatric provider. So now I know a little more as far as integrated psychiatry. So since opening my private practice, I have helped many nurses. I sometimes get emails or calls from people that they're interested in opening their private practice. They want a little advice as far as what to start, all the goodies about taxes and LLC or corporation, what type of business, how to advertise, just little things like that. So I'm helping our practitioners, entrepreneurs to start their businesses, which has been pretty fun. So always kind of moving. But this journey, yes, I told you about my journey and all the obstacles, but I really want you is just to take away this. I want you to believe in yourself. I know that wherever you guys are, just doing your BSN, having your master's, or doing your PhD, or any point in your life, sometimes you're gonna doubt yourself, and it's okay to doubt yourself. It is okay, because that's gonna make question mark like, should I take this path or not? But always at the end, believe in yourself. Be confident. Always be confident of what you do. Yeah, sometimes we don't know the answer, but that actually taught me that no matter where you are in life, You have to have the confidence. Don't dwell on excuses. We all have those good excuses, right? Oh, I'm gonna start doing this. Oh, but maybe this is a little difficult. Oh, maybe I don't know. Just keep on going. Don't dwell, don't dwell. Just do it. And if you see obstacles, because you will see obstacles, just see them as new challenges. So how can you be better, and how can you bypass those challenges? So they're not obstacles, they're challenges. And grow, always grow in your career. Don't get stuck, because it's so easy just to lay back and then just think, okay, I think I accomplished everything. And then 10 years later, then you get bored. It's not okay. It's always good for you to keep going. Specialize. If you're doing your BSN right now, go ahead and specialize something that you're really passionate about. Because remember, you're gonna be a nurse for a long time. Nurse practitioner. You have to like it a lot, right? You have to choose something that you like. And so if you're in the BSN, whenever you're ready to get hired, choose something that you're really interested in, then start going and be good at it and specialize in that. Nurse practitioner, the same. Obviously, you're a little more centralized and you have that, but be good at it, what you're doing. Just be that special, have that specialty in you. And then I have to tell you this, but be a nice preceptor. Even if you're a BSN, master's, PhD, always precept. We always need you guys to help students, but be a nice one. Always put you, think about the person that are going into you. They probably have a lot of shyness, they get intimidated, they don't know much about a lot of things, and it's okay for you to guide them, but always be nice. We need to contribute to our nursing profession, and it's not cool if you're not nice. Also be a mentor to somebody. So not always, be a preceptor, but always try to mentor somebody, because it's very fulfilling. It's very fulfilling just to mentor somebody. And you never know. You can always change people's lives, and you sometimes don't even know. And that's the reason I talk about those people. I think I talk about 4 people, mentor, because they really contribute as what I want it to be. Define yourself, have clear goals and visions in life. It's kind of like the same, don't get stuck and grow. And this is pretty self-explanatory, but this is a very important one. Always be humble, always. Yes, you can talk about your success, it's good, but be humble, be approachable to people, and always learn from your feedback, from your mistakes. And the last thing is never give up. Never give up. It does not matter how slowly you go, as long as you do not stop. So don't stop. Never give up. And I'm proud of you guys that you guys are trying to do future voices. I really encourage you guys to keep up on doing the good work. We need you, and thank you for having me today. It's a pleasure.
Thank you so much, Kelly. We really appreciate your time and sharing your journey with us. We're grateful to have you, and we appreciate the insight and advice that you've provided us. So thank you again. We would just like to open up the floor to our audience for the last few minutes to see if anyone has questions for Kelly. Just unmute yourself and ask the question directly to her.
Kelly, thank you so much for sharing with us today. I really appreciate getting to hear your journey and just how much you've overcome in doing that. I think it definitely gives me some motivation when I have all these setbacks. Would you be able to share kind of, I know you said you're bilingual, so could you speak to your bilingual ability and opening doors for you that maybe it would not have otherwise opened?
Yes. So I think I when I was doing this, I was thinking so much. I used to say like, oh, my accent. So that was a big limitation for me. But I noticed that being here in Colorado, that was actually pretty good for me for being bilingual, because I set out first that there were only just a few people bilingual, and more in the nursing career. I was doing a little research, and it's like 10% or so are fully bilingual. So it did really open the doors. Don't be afraid, even if you feel that you don't know much about Spanish or any other. Honestly, I mean, I have encountered so many other fellow nurses that know a little bit of French, but that actually kind of opened the door for those little bit of French speakers. So don't limit yourself. Yeah, I mean, sometimes we want to be perfect, right? And that's how I felt like, oh, I need. Well, obviously, Spanish is my first language, so I didn't have any problem. But with other people, sometimes people want to be perfect, mastering, and it's not easy. You're gonna learn. This is it's a journey as well. So if you want to take that, sell yourself. If you're bilingual, definitely sell yourself as bilingual, because we, especially in Colorado, we do have such a diversity. I mean, it's incredible. We have a lot of people from different countries, and I don't know if you guys knew, but Aurora is one of the most diverse cities, we call it cities, in the nation. So can you believe that? Aurora, we're talking about Aurora, because have so many small communities, and we need you to solve yourself with that ability to speak whatever language you are, because we do need you, and actually that kind of helps.
I have a question, Kelly. How would you say that we can all be better nurses to our psych patients in practice?
Good question. You have to go back to the basics. Just be a nurse. As easy as that. Just be caring to that person, even if you don't know much about the illness that they're going through. Sometimes they just need that person who is next to their bedside, and just to be there, just holding their hand, or listening to them. This is what nurses are, right? Just being there, advocating for their needs, right? Sometimes they're not able to advocate for their own needs. So you guys are good at it. That's why you chose this profession, nurses. We care. And honestly, that's the reason that I feel that, I mean, obviously I'm super biased, but I do feel that psychiatric nurse practitioners are really good with patients, because we do have that caring aspect as nurses. And you don't have to know much about mental illness. You don't need to know much about maybe medications in psychiatry. You just need to have that person who can actually advocate for their needs. Maybe find some resources. If you notice that person is depressed, okay, go ahead and ask, okay, do they have a therapist? Maybe just contact them with a community mental health center, something like that. So resources, but always just be there just for them, so they can actually open up with you guys. You guys are the first ones that they're gonna see, and probably you're gonna be the first one who they're gonna open up. So.
It looks like we have a question in the chat, and this will be the last one since we're running out of time. They asked a couple of questions actually, but I'll just go to the last one. Have you published any of your experiences on a peer-reviewed platform?
Okay, which one are you? I'm sorry, I wasn't paying attention. Okay, yes, I see it. Did you play any of the 6 months of peer review? No, I haven't.
I do have one last question, Mara, if that's okay. All right. Hey, Kelly, so you mentioned integrative holistic care. What exactly does that look like as far as treatment modalities? Can you give us a few examples of how you would, let's say someone with depression who's not interested in typical antidepressants, what do you offer them at that point?
Good question. So integrative is anything but pretty much what we offer as, in psychiatry, so no medication. So sometimes it's hard, right? I mean, yes, I do have people with schizophrenia. I'm not gonna say, hey, I have a little supplement here, because maybe I'm gonna do more harm than good. So I have to be wise as far as, what people can actually do good. So there's a lot of studies done for certain supplements. There's definitely some people who don't want maybe take antidepressants. They can take several supplements just to help with their mood. Some of them can be for helping a little bit with mania. There's a lot of nutritional deficiencies, so we do use a lot of the vitamins in the nutritional upscale vitamins just to help out, especially people who have bipolar, because they have a lot of chemistry imbalances and schizophrenia. So pretty much a lot of vitamins, a lot of supplements for anxiety I use a lot, and the gut. There's a lot of good information about the leaky gut, the gut healing, and how actually, because we do have a lot of the receptors, serotonin receptors, dopamine receptors in our gut, and if we're not taking care of the gut, then whatever you are giving the patient, probably they're not gonna process the same thing. So we're kind of like really focusing on the gut, healing the gut, and go from there.
Thank you.
Well, thank you again, Kelly, for your time. We really appreciate it. And thank you all in the audience for attending this event. Please look out for more events that Future Voices will hold. You can see our website there below. And I hope everyone has a wonderful day and is intentional about the care that they give as a nurse and as a student. Take care, everyone.
Bye.
Thank you so much.
Thank you.